what's interesting is that they've set a date. It's very specific. I mean, it's you can look it up. It's super specific, and they set the date by 2027. And what's so interesting about that date is if you want to be ready for that, you got to start now.
Yeah.
Because 2027, if you got things you need to do in your end-to-end production and operations, now is the time to do it if you want to be ready for 2027.
Hello and welcome to the Sustainable Healthcare Podcast. This is the show where we look at decarbonizing the healthcare sector. Today I have a special guest in the studio. It's my newborn son. He's 5 months old, so pardon if he interrupts a little bit. We're decarbonizing the healthcare sector and we're sharing the tools and tactics of various experts that are working every day on this agenda. And today I have the pleasure of having with me, besides my son, Kristoffer in the studio. Welcome to the studio, Kristoffer.
Thank you so much. I've been looking forward to coming back here. So
I know
so happy
you
to
have.
be here.
And today we're going to talk about commercialization. And we're going to talk about some of the challenges that commercial organizations, particularly in pharma, are facing. So maybe we should take the listeners through the journey of a commercial organization in a pharma company. Could you give us some insights to the lay of the land? What is a commercial organization and what characterizes it for a pharma company?
Well, I think sort of there's different ways to sort of address that, but I think what the commercial organization really does is connecting. It's connecting the company with the rest of the world, because that's where the intersect happens. So a pharma company, you typically would have headquarters, let's say, in the UK, for example, it might be. Some have the headquarters there in Switzerland, but then to go to market to sell their product, the medicines or the devices or whatever, they have local organizations, local commercial organizations. And those local commercial organizations then engage with healthcare providers and payers to sell their services or sell their products, sell their devices. So in that sense, the commercial organization is the interlocutor, the connector between the company and the providers, the buyers.
For sure. And each of them have to have a quite local office, either nationwide, sometimes statewide even, or in regions like Scandinavia or the Nordics or whatever categories might be meaningful.
I mean, yeah. I mean, it's that's sort of been the end point right now, because it's driven really by the fact that the healthcare sector and the way it's organized is different.
Yeah.
Country for country, and so the way that the buyers on the buy side, the payers, the healthcare providers are organized is different. So you got to be able to have a local organization, a local commercial organization that reflects that, are able to actually connect with those organizations and be able to understand what is it that they need at what quantities, when, etc. Right. So it has a very localized angle that really is a function of how that particular healthcare system is set up in terms of insurance, national, private, payers, buyers. It's all these things they interact to then let the pharma company decide on how do we best address that market, and that would typically be by having a local or regional organization that takes care of that particular market.
And typically, the way the product actually goes to market, a lot of these organizations are using a model that looks a lot like door-to-door sales with general practitioners or other healthcare providers. So I've seen many organizations that have very large car fleets, for instance, because the commercial organization is driving around all day, visiting clinics and positioning the products and pitching the products to the practitioners. So in a way, we have to do with a highly fragmented, localized organization within an organization that typically will be global. Is that a fair representation?
I think it's a fair representation. I think it's an interesting point of view that the digital transformation really hasn't yet made it to those kinds of sales processes. They're in that sense pretty old school in the way that they are. Depends a little bit on the therapeutic area, on the structure of the market, but to some extent, yes, they are actually set up by either having nurses ride around in cars and visiting, healthcare providers, or having other types of salespeople visiting with the buyers face to face. So yeah, there's a lot of face to face interaction, a lot of feet on the ground. Yeah, and I think that's fair.
And I mean, traditionally, we've been looking at how effective is a drug or a device or a treatment, and what is the price. Those have been the defining parameters. But now in
safety.
And safety, of course. And those parameters have been what we're looking at. Like, we have to know if it's safe to use, we have to know if it's efficient, and we have to be able to justify the cost of it. But now, what has changed in the overall situation for commercial organizations from your point of view?
I think those parameters are exactly the ones that have been in focus and are still in focus. I think I would add a parameter that has driven I think a lot, at least in the Western countries, and it's driven a lot of provision of healthcare products, especially on the device side. It's been that there's been a preference for products that could help the efficiency at healthcare providers. So if it was, made it easier to provide the service, single-use products has been much in vogue, and that has been driven by the fact that it's been able to then let healthcare providers become more productive, spend less time on cleaning. So in that sense, it's not sort of a direct implication of the product, but it's a function of the fact that the product is used and what setting is it used in. And I think it's interesting because that sort of patient care pathway and how your product influences that is actually something that impacts also this new paradigm. Because what you're alluding to, of course, is that there's now coming into fuller force, or in some cases real full force, is sustainability requirements.
And how do we see that? What is it? What is it that tells us that this is going to be a defining parameter for this industry?
I think what we see now is that some of the major, or one of the major players, the National Healthcare System of the UK has come up with some very, very firm commitments. So on the provider side, on the payer side, you see real clear guidance. By 2027, they will not deal with any company that is not set clear climate reduction targets that align with the Paris Accord, which is one way to make sure the alignment is there is science-based targets. I think so. That's one movement, but I think that movement is also a reflection of the fact that companies across the board, especially bigger companies, especially companies based in Europe, it's now become the exception that you don't have climate reduction targets. I mean, the tables have really turned.
And fast.
Year-on-year uptake from 21 to 22 was 50% on science-based targets.
Wow.
Net zero commitments. It's dramatic.
Yeah, that's quite
and it's a game changer because once you reach that threshold of plus 50%, then it stands out if you're one of the laggards. And the fact that the big companies move in this direction, that will create a natural pull for the smaller, medium-sized companies because they are pushing, cascading down their requirements. So on both sides of this healthcare sector, both on the pharma and medtech producer side and on the buyer side, you see strong movement.
For sure, and I mean, I think it's very interesting to see such a large stakeholder as the NHS, arguably the largest single healthcare provider in the world, pushing such demands. So there it's quite clear. I mean, we have a decarbonization roadmap for the scopes 1, 2, and 3, and you have to fulfill that by a certain date. So that is very hard to misinterpret, but what kind of ambiguity do you see in those sustainability requirements that are emerging everywhere?
Sure. No. So I think there you have a lot of clarity. I think what's interesting is that they've set a date. It's very specific. I mean, it's you can look it up. It's super specific, and they set the date by 2027. And And what's so interesting about that date is if you want to be ready for that, you got to start now. Because 2027, if you got things you need to do in your end-to-end production and operations, now is the time to do it if you want to be ready for 2027. Now, that's not the only thing that's happening. This focus on what would be corporate level commitments to, in this case, decarbonization. Sustainability obviously is a range of different factors. And what we see across the board is that there's a wide disparity across markets in terms of finding ways in which to address sustainability. One client we engaged with had identified across their business more than 260 different types of requirements that they've met.
Yeah, that's a lot.
That is a lot. That is significant. Yeah. And in that sense, to be able to service the market, all of a sudden you now have 260 plus new types of requirements. Now, that was just one client doing research on their therapeutic area in that one point in time. And we also know this is super dynamic. I wouldn't say on a daily basis, but on a monthly basis, we see new types of requirements coming out. So we had a client coming in and was just, a little bit, I think, a little bit sort of shocked or surprised, if to say the least, because they've been met with a tender requirement in this case that the packaging had to have a certain minimum amount of recycled fibers. Mm-hmm. And what's interesting about that case is that it was set, I think it was, it doesn't really matter. Maybe it was set at plus 85% or something. But the client sort of was surprised. First of all, that's sort of the first thing, right? A tender comes in the door and there's a requirement you haven't seen before. And you're wondering, can we even meet that requirement? So that's one, right? So you haven't seen it. You got to respond to a tender within a fairly short timeline, right? And it's a very, very real, very sort of definitive target. It's not sort of tell us a little bit about your company. It's really, you got to be above this threshold, right? And I think it's a good case in the sense that now the client at first thought they wouldn't be able to meet the requirement, but then realized after some due diligence that they actually could. So they were able to bid for it, but imagine the cost and agony that was involved in that process.
It's kind of like Gloria Gaynor. First they were afraid, they were petrified.
Yeah. Exactly. And so it provokes the thought that next time, maybe it will be a requirement we can't meet. And one has to recall that if you meet a tender requirement you can't meet, some of these things can be difficult to change on a short notice. You don't just change your packaging or other parts of your product overnight. Some of these things can take years to change, even though they may be trivial or simple. They could take quite a bit of time to change.
And in such a highly regulated industry, it can actually be several years just to change the inner lining of a packaging. So I think you're absolutely right that we're seeing a very diverse portfolio of requirements that come, and they're not organized after predictable logic. So they're quite difficult to predict because it's such an emerging field that is in its infancy.
Sure. So what we see is that there's actually sort of two currents going on right now. There's some homogeneity coming in on decarbonization, but at the same time and in parallel, we see heterogeneity. We see buyers and healthcare providers asking for different things. So it creates a lot of uncertainty on what will be the requirement I would need to meet. We did a mapping in Switzerland of how many sustainability requirements you saw in that market, and we were in the 600 plus different types of sustainability requirements coming out. Now, so we see these different types of movements, and I think it's very costly to do. It may be even, in some cases, not possible to do at all. So you may see markets just disappear because it's too costly for you to organize your production processes in that particular way. And in that sense, it's pretty important. And I think what we see across the board is actually that there are some insights, there's some ways to deal with this and tackle this. But what's so interesting and so difficult for pharma and medtech companies is it cuts across silos in a whole new way. You used to have a sustainability department that sort of on a corporate level looked at your corporate way of doing things. Now, the commercial offices are in a different reality. It's a completely different reality. Yes, some of the requirements are asking about corporate level commitments. The NHS is science-based targets is one of them. But you are also met with product level requirements, criteria. And that's where the disconnect starts to happen. So we, for example, see an increased focus on life cycle analysis that is asked for particular products. Now, that has a couple of implications. If you don't have it, you can't just do it. It takes time. It takes quite a bit of effort.
If you want to have one that's believable, I think that's another side to that story, that setting the boundaries to provide a good LCA is incredibly complex. And if you want to, as a buyer, do a like-for-like comparison of two products, you can look at their clinical impact. That's relatively well-researched and evidence-based, typically. You can look at the cost. That's indisputable.
Sure.
Then you could look at the healthcare pathway effect, so the evidence-based analysis of what is the effect of this treatment with this product for the patient, at which cost. But then if you start implementing a life cycle assessment into that, it becomes incredibly complex because there's so many boundaries. Where did the nickel come from? Was it sourced in Congo or in Panama?
There's that, and just the thought, if you, let's say you're a fairly big company and you have a fair amount of SKUs, and you're looking into doing LCAs for each SKU, which is actually what you kind of need to do, is what is being asked for. It's going to be, I think, for many prohibitively expensive. And not just complex, etc., but very, very expensive to do, and not desirable from that sense. And what to do about that? What to do about that whole situation? I think that's where we're working with some forward-looking clients. We're working on a really set of interesting ways to tackle this. Ways in which where you go from a situation where you're being reactive and these requirements come, from the sky almost down and drop on your table, and you don't know what to do. And
you kind of have to be Elastigirl and try and grab everything at once.
And you spend a lot of additional time, I think, by responding ad hoc. And scrambling to find the right materials that you could submit. You don't know how the competitors are doing on that particular parameter, so you don't know how you're going to score if it's a scoring criteria, and you don't know what's going to be next. And this is the encouraging news: is there are ways around this, because why are these requirements coming up, and why are they coming up in this way, in this fashion? And that's, I think, where there are some interesting insights that can and will help. We see that the clients think when clients start thinking this way, it's helping them. It's helping them respond better, more cost effective, and more competitively to these requests.
And they're also creating value for their clients, actually.
And they're creating tremendous value for client, because the subtle insight here is that why is this coming? It's becoming these questions are coming because sitting from the chair of the healthcare provider, they're looking into their impact on the world. And they're looking to decarbonize. If we take carbon as an example, they're looking to decarbonize end-to-end what they are doing. So let's take a hospital as an example. They would look at their scope 1, 2, and 3 and see what are the different impacts coming in here. And they're asking these questions because they want to reduce the climate impact. And what we see now, the LCA is a result of them looking at their scope 3, where there's a lot of emissions, and where their thinking is, could we just bring these emissions down? So if we can choose a product that has a lower footprint than another product, then we'll bring our scope 3 down.
That's kind of the governing logic.
So that's where all these requirements are coming from. They're coming from the perception, from the viewpoint of the healthcare provider. And that's where the key lies, is to understand how do you as a pharma company not just decarbonize your own footprint, but how do you enable the healthcare provider, the payer, to decarbonize theirs. And that's outside the scope of a lot of companies to do that. When we think about their how they organize their efforts around decarbonization, it's typically around their own scope 1 and 2 and their own scope 3, and not so much as the use of their products sold. So that's really where there's a lot of where there's a pathway to actually cut through all of these things. And I'll give you an example of how powerfully and how different a response would be. Now, you could do an LCA for your particular product, and it may turn out that you could do something to reduce it by 10%, the climate footprint, right? Now, you might imagine that you do a different formulation, which is, let's say, more effective. So instead of having, let's say, 3 injections, you go to 2 injections. But because it's more effective, it has more, of the effective dose, the footprint is, the LCA footprint is higher. So on a like-for-like comparison, you would think, well, you're losing ground, but you're not. And that's because when you look from a provider's care point of view, one less trip to the hospital is dominant. So if you want to help them decarbonize, it's really about understanding how does your product, your device impact how the healthcare provider provides the service, and what's the net total of this impact. So, and I think it's a good rule of thumb. If you have a product where it takes one less trip, it's such a dominant factor. The travel of patients, the travel of staff, the use of buildings, etc. It's such an important driver of in this case carbon that not in all cases, but in a lot of cases that would be a superior product. So you see the dilemma here. You have an LCA which is on the face value worse, but the reality is it's better. And that's where when we help clients, we're able to sort of pass through this and say, well, actually we know why you're doing this, and we have a better solution. And because the solution is helping you decarbonize faster and better. And by the way, your patients actually appreciate one less trip to the hospital as well. So in that sense, there is a way to counter all these requirements, become more effective in responding to them, and it's actually by not responding to the direct ask of the LCA. And that's where the tricky part lies, is that if you only go tender by tender, you're drowning in requirements, you're drowning in LCAs. And really what you need to do is you need to take a step back and understand, how can we, as a provider to let's say a hospital, how can we help them decarbonize? What are the better ways in which we enable them to decarbonize instead of responding to the direct requirement?
So it's kind of like becoming a choreographer rather than just dancing to the beat as it comes.
Yeah, it's actually, taking one more step back and then realizing the world is bigger than just our corporate footprint or our product footprint, and we can actually contribute more to the decarbonization by doing this other thing. And it also drives a lot of competitiveness. We do see, if I can come back to this Finland case, when a requirement like 85% recycled fiber in packaging comes up, it always raises the question on who planted that seed, who came out with the idea. Now, obviously, it's a good idea to have recycled fiber. I mean, no doubt. I mean, who could be against that? But is it material? I mean, is it an important part of a decarbonization journey? It's a part of it. Important, not so sure. When you look at the numbers, it's perhaps more important to have one less trip to the hospital. But somebody came up with this idea, and that's where we see this being used very proactively by some players, where they're trying to change the scales in terms of competitiveness, to be able to sort of put their criteria on the table and say, this is driving change in a positive direction. And we see healthcare providers struggling to find good ways to decarbonize, good ways to have less of an impact, accepting these new ideas, and they should. It's just, present them with even better ideas. It's what the game is about now, is understanding how does your product, device, etc. work, and how can we make this work for them? And making that case, and in that sense, being able to manage your costs, your risks, and be commercially successful around this. That's what we see the most forward-looking companies do, is look at that whole situation, competitors, what providers and payers are asking for, and cutting through that and finding what is the strategic response that will lower our costs and increase our competitiveness. And what's wonderful about that is that more than ever, if you follow climate news, etc., things are not going the right direction. Yeah. So we need, and we love to help companies become super ambitious on this agenda, and do what we would even label weaponizing climate change to win the market. Because if they are moving this scale forward dramatically, winning the market, competitors need to follow. Yeah. And we all win because now it's decarbonized. So that's our favorite projects these days, is to work with clients that want to go on this journey, want to avoid the risk of not doing it, avoid the cost of responding to copious amounts of requirements, and change actually how the game works in terms of getting to decarbonization.
Leading from the front on the decarbonization agenda.
Exactly.
Thanks a lot, Chris. I'll just briefly summarize. So today we've looked at the commercial reality of pharma companies. Typically, commercial organizations are fragmented outside of the geographies where the headquarters of a company is situated. It's the connecting link between the patient and the provider of a drug or a device. And these commercial organizations will typically have to respond to a lot of different local requirements that sometimes appear sporadically, sometimes appear from a central hold, like the NHS, saying that providers will have to be Paris-aligned by 2027. But other times it can be something seemingly random, like a Finnish requirement for recycled fibers in packaging, or one of the 661 requirements that are or sustainability indicators that have been posted in a Swiss context. And the key question is actually how might you turn that into your advantage in a commercial organization? How might you weaponize the decarbonization efforts by looking at the entire care pathway and the impacts that are associated with that? Is that a fair representation of?
I think that's a brilliant representation. So it's really about being able to respond proactively to what's going on in the market, and if you don't, you're both at greater risk, at greater cost, and in a situation where you don't know what the future brings. So yeah, I think that's a really good and fair summary. Absolutely.
Cool. Thank you so much for coming to the studio, Chris, and thank you, Son, for providing your very valuable input whenever you had something to add to the discussion. Thank you for listening to this episode of the Sustainable Healthcare Podcast. Remember that you can subscribe on Apple Podcast or Spotify or wherever you get your podcast. Last year, we were in the top 5% most shared podcasts on Spotify. So we really appreciate you sharing the show, sharing it with your colleagues, with your friends, with whomever could be interested in the agenda. And thanks for commenting, liking, sharing, suggesting new guests, and for following us on this journey to have a decarbonized healthcare sector. Thank you. Cheers.